Hi, everyone. Welcome. We will let folks file in. Feel free to introduce yourself in the chat. We'll probably get rolling right at 12:02, so giving people a couple minutes to jump in, and then we'll get started. Good afternoon, everyone. Welcome, welcome again. Please feel free to come in, settle in, warm up your lunch, grab your beverage. We'll get started in just a couple minutes here. Feel free to say some hellos in the chat. Hi, Jeff. Hi, Milani. Oh, I love this. I love this. I'm trying to see my little panel that tells me how many folks are with us. Got shifted behind. We have 50 people who are on with us right now, so we will go ahead and get rolling. Thank you, everybody. Please feel free to, again, continue to settle in. Hello, Happy New Year. Welcome to our very first 2025, but very first Getting to Zero Illinois Community Conversation. I'm Meg McElroy. I use she and her pronouns. I'm the Director of Special Projects at AIDS Foundation Chicago, which means I lead our Getting to Zero work. I'm thrilled that everyone's chosen to join us for their lunch. I hope you're all staying warm. Settle in. Feel free again to keep kind of jumping into the chat. Hi to Tawana. Hello from like across the state. This is so lovely to see everybody tuning in. I'm really excited. My wonderful colleague, Timothy Jackson, is here with us today. Tim is the Senior Director of Policy and Advocacy at AIDS Foundation Chicago. We're going to be talking about the recent company bulletin that was issued by the Illinois Department of Insurance about PrEP and PEP. So if that's what you thought you were signing up for, if that's the meeting you're in, welcome. We're glad you're here. If that's not what you thought we would be talking about, please feel free to stay, join us, or you can excuse yourself for your lunch hour. But let's go ahead and get rolling. So before we move into this really important conversation, one of the things that we're doing for Getting to Zero and AIDS Foundation is really taking a moment to ground ourselves in kind of the moment in this important discussion and all those who have come before us in this. So please go ahead and take a moment with me. AIDS Foundation Chicago acknowledges that racism is a pervasive public health crisis that continues to impact the health and well-being of individuals and communities, especially Black, Latina, Indigenous, and other people of color. This crisis is rooted in systemic inequalities that persist in our healthcare, economic, and social systems, leading to profound disparities in health outcomes, access to resources, and opportunities for thriving. In our work at AFC and in Getting to Zero, we commit to confronting these inequities, advocating for justice, and centering the voices of those most affected by this crisis as we strive to build a more equitable and inclusive future. While this conversation is occurring virtually and folks are tuning in from all over, AFC's office is located in what is now known as Chicago, on the traditional homeland of the people of the Three Fires, the Potawatomi, the Ottawa, and the Ojibwe, as well as the Menominee, the Miami, and the Ho-Chunk nations. This area, Chicago, was a site of trade, travel, gathering, and healing for more than a dozen other Native tribes and is still home to over 100,000 tribal members in the state of Illinois. We understand the grave harm that settler colonialism, including theft, violence, and broken treaties, brought to these lands and the people. Nevertheless, the people of the Three Fires continue to live throughout the Great Lakes region as they have for centuries. We at AIDS Foundation and Getting to Zero acknowledge the people of the Three Fires as the traditional stewards of this land and remember their ancestors who resisted and the descendants who also resist and remain. All right, folks, I'm going to go ahead and drop a link in the chat. I encourage you, if you have not explored anything about the traditional lands which you might be joining us from, I encourage folks to go ahead and use this link. Let's go ahead and hold and center the people who have come before us as we move into today's conversation. So We are here to discuss how Illinois is leading the way in expanding access to PrEP and PEP, how Illinois is removing barriers to prevention and making strides towards our getting to zero goals. Tim and I really want to slow it down and break it down. When you're in this work all day, every day, sometimes the acronyms fly around like alphabet soup. And so at any time, if you have questions about an acronym, how something is related, if you're not understanding a piece of the conversation, I know that I have sat in meetings where I am like nodding and smiling, and I'm like, I don't know what the heck that means. And Tim, I know you have too. We've talked about this before. So we really want to make sure that people are along with us on this conversation. Tim is a phenomenal presenter. He's going to really enlighten us about a lot of things. But if you don't know something, please use the Q&A, which is open for questions, or use the chat. I'm going to try and keep my eye on everything in today's conversation. And if a question comes up, we'll try and answer it kind of in real time. So really quick before I introduce Tim formally, I want to provide just a moment of background about the Illinois Department of Insurance, otherwise known as DOI. They are a state agency who are responsible for regulating the insurance industry in Illinois. Its mission is to protect consumers by ensuring that insurance companies, say that one like a million times fast, ensuring insurance companies comply with state laws and regulations, promote market stability, and facilitate access to affordable and adequate insurance coverage. So the department oversees a variety of types of insurance, including health, life, auto, and property insurance. And they work to enforce consumer protection measures and ensure fair treatment of policyholders and address complaints that individuals and organizations have. The other brief piece of background just before we kind of roll into the conversation is about Company Bulletin 2024-18. So that is the bulletin we're talking about. It was issued by the Illinois Department of Insurance. It's a significant policy development that expands coverage and care requirements for PrEP, or pre-exposure prophylaxis, and PEP, post-exposure prophylaxis, which we know are the medications that are used to prevent HIV transmission. This bulletin outlines new guidelines for insurance companies operating in Illinois. It requires them to provide comprehensive coverage for PrEP-related services without imposing undue barriers such as prior authorization, step therapy, or excessive cost sharing. The bulletin aligns with national public health efforts to increase access to PrEP as a key HIV prevention tool, and it reflects Illinois' commitment to advancing health equity and access for care for those vulnerable to HIV. We have put together at AFC a one-pager to really help break down kind of what is included in this bulletin. And that is something we'll share later today, but also something that, as Tim talks, I can try and drop into the chat. So that is background. We're going to talk about all of these things. I want to introduce my amazing friend, Timothy Jackson. It is an honor and a privilege to share space with him. So Tim serves as the Senior Director of Policy and Advocacy at AIDS Foundation Chicago, where he leads, guides, and supports the development, implementation, and management of AFC's federal, state, county, and city government relations and policy and advocacy activities. So, Tim's not really doing much these days, just kind of sitting on his hands, not really worried. But no, Tim's plate is so incredibly full, you guys, like amazingly full. So thank you for taking time, Tim, to talk with us. But Tim does all of that to address meaningfully address the HIV/AIDS epidemics and our housing and homelessness epidemic. So as a Black gay man living with HIV, Tim's career is deeply rooted in advocating on behalf of people living with and vulnerable to HIV, amplifying their voices, addressing the impact of HIV on communities where his identities intersect. Welcome to the conversation, Tim.
Thank you so much, Meg, for having me.
Okay. I'm going to go ahead and drop my slides so that people are able to see Tim and I, our faces. I'll pull them up at the end of the conversation for next steps, QR codes, links, all of that. I have a series of questions. I'm going to keep an eye on the time. I'm going to keep an eye on the chat and the Q&A. So please feel free to utilize those. But they're all open, so let's go ahead and get rolling. Tim, my first question for you in the very first community conversation. Help us understand, give us an overview. What is this bulletin 2024-18 and what are the most significant changes it introduces?
Yeah, well, thank you so much, Meg, and thank you for everyone joining us. Essentially, what a company bulletin is anytime that the Department of Insurance puts this out, it is something that is sent to insurers provide further guidance on how laws and other federal guidance should be applied. And so this company bulletin 2024-18, what it really does is really hits just about everything that we needed and had been requesting from DOI officials as it pertains to coverage for all FDA approved PrEP and PEP medications. And so we are talking oral, we are talking injectables as well. And it basically outlines that there should not be any cost sharing and no deductibles, no co-payments, no co-insurance for PrEP or its ancillary services. The way that the bulletin outlines it is no includes follow-up services like counseling, side effect management. I'm going to read it directly from the bulletin. Policies also must cover related follow-up services, including but not limited to management of side effects, medication self-management or adherence counseling, risk reduction strategies, and mental health counseling. So that's also huge. Another thing that this bulletin covers is that it prohibits what we know as utilization management tools. So think of step therapy, think of prior authorization, waiting periods. None of those are supposed to be used for PrEP or PEP. Zero, not a single thing. Again, I'm going to read directly from the bulletin, which this is outlined in state law. As a result, well, I'll just say, read it this way: a policy or certificate shall not impose any restrictions or delays on coverage for PrEP, PEP, or the related follow up services. And as a result, prior authorization, step therapy, waiting periods, and pre existing condition exclusions are prohibited for these items and services. So, this is again something that we have been doing a great deal of work around for essentially the entire time I've been at AFC, and I've been at AFC for 5 years and a couple of weeks. And so the entire time I've been at AFC, and even before I got here, have been really working on how do we remove the barriers to PrEP access. And this company bulletin will go a long way in allowing us to do just that.
Absolutely. Thanks, Tim, for really kind of kicking it off and laying the groundwork about like what we're talking about. And I was born and raised here in Illinois. I like to brag on Illinois when I get the chance. How does this compare to, without naming names, how does this compare to what's happening kind of in other states when we think about PrEP access?
Uh, Illinois' PrEP access is generally pretty good, especially when we compare it to our Midwestern counterparts. PrEP uptake is higher in Illinois compared to our Midwestern counterparts. Generally, the way that I look at things when we talk about policies, especially state policy, is that we are generally, Illinois is typically in the class of these other states, usually Oregon, Colorado, California, and New York, usually. And so we are right about center mass of that. So we're doing pretty well. There are some other things that we're going to be looking at too, because again, I want to remove every barrier to PrEP access. But this is definitely a great start.
And Tim, you had mentioned utilization management. You had mentioned things like cost sharing. I know like it gets tricky when you start to really dig into insurance policy, how that's all implemented. Can you
Mhm.
walk folks through and talk to us about the elimination of cost sharing? What does that mean for individuals and communities who are seeking PrEP or PEP?
Yeah, it's just as simply that there should not be any costs associated at all for PrEP at any level. And so what that means is obviously we know that there are communities that need PrEP more than others. So I'm thinking of Black and Latinx, gay and bisexual men, Black cis women, Black trans women. These communities need it more than others. And so how do we really have an intentional emphasis on getting it? Is by removing these barriers. And so when we talk about no co-insurance, no copay, no cost sharing, that is a great way to remove again another barrier so people can get it, because we know if you go to a clinic and they tell you it's going to be this amount of money, and you've already been borrowing from Peter to pay Paul, What's likely going to happen? Well, I just won't get it today. And then what's the likelihood of you trying it again? Probably not very good. So if we can remove those barriers from that first time, then that's going to go again a long way in making sure that we get people onto PrEP and make it really. My vision for this is to make it to where PrEP is truly the option for everyone. And so that's just as simple as I can put it.
No, I love that, Tim. And I think, as we have conversations, we know that HIV care, prevention, treatment, like that is just one aspect of somebody's life. And so if people are juggling 10 other things
Yeah.
and all of a sudden we put a barrier in somebody's way, like how likely is somebody to try to overcome that barrier? Some folks will, some folks might not. And that could be the thing that either allows somebody to access prevention
Yep.
medications, or to say, this isn't really worth it for me, and might not engage in that really vital kind of prevention tool. You had named a couple of communities, and we have priority populations who are outlined
Absolutely.
in getting to zero. Talk to me from your perspective. How will this bulletin change lives of individuals who are most vulnerable to HIV in Illinois?
You know, it will just again is another opportunity for us to, and I'm going to sound like a broken clock, or that's kind of removing this barrier. But I have talked to a number of different, cabs, and I was talking to some providers yesterday, and we keep running into some of these same issues. And so my thinking about this is how can we actively end the HIV epidemic if we know that we have the tools to do so, but people can't access them. And so when we talk about Black cis women, or when we talk about Latinx gay and bisexual men, who those new cases are rising here in Illinois, what can we do intentionally to make sure that they get access to PrEP? And so knowing what the numbers are right now, and knowing that we have something like this bulletin, we can then use this to create programs and services directly for these affected populations and communities, and say, hey, what does it look like? What does PrEP access look like for Black cis women? What does it look like for Black and Latinx gay and bisexual men? What does that look like? And so this bulletin is going to allow us to do that. Again, this is not the end. This is just a continuation of several years of work put in to make sure that when someone goes to a provider, whether that is the pharmacist counter, whether that is a nurse practitioner, anyone, whether they're trying to get PrEP, they should be able to get it. And cost and prior authorization and other things like that should not be in their way.
That's great, Tim. And I see somebody asked a question, which I think is a really important question in our Q&A. I think oftentimes when we talk about HIV care and prevention medications,
Mhm.
we're talking about the actual medication. But somebody asked, will this cover the cost of labs too?
Yes, absolutely. Absolutely. It will cover everything. Again, I just want to read through the management of side effects, medication self management, adherence counseling, risk reduction strategies, mental health counseling, just to let you to give you a little kind of backstory. When we worked to basically get this encoded in law. So not only is it part of federal guidance that PrEP is supposed to be covered without cost sharing and the ancillary services, we've worked to get it encoded in state law as well. So no matter what happens in DC, it is also encoded in state law. The issue that we ran into is, though, when we worked on that bill in 2023, is it basically was that management of side effects, that language was kind of very prescriptive. I wanted it broader.
Mhm.
And so we may be looking at doing some additional kind of tinkering to make it even broader. Because again, what I don't want is something I don't like confusion.
Mhm.
And obviously when you're dealing with insurance and all of the things, there are a lot of things that can be confusing. And so if we can go back later and see if we can go back into the law, and see if we can tinker it to be very specific that it is saying lab tests, that it's saying doctor's visits, if it's saying all of these specific things, kind of things that we like to hear in community, then I think that's something that we're going to definitely be looking at, possibly this session, if not this session, next session.
Tim, I love that, we are talking about like how do we make it more clear? How do we make it more accessible? How do we make this information easier
Yeah.
to understand? And I think one of the exciting things too, it's not just written for it's January 23rd, 2025. It's not just written for like what does PrEP and prevention care look like today, but also like what does it look like 5 years from now, 10 years from now,
Yes.
and the advancements. We know medication and prevention options far outpace our policy always, like the
Yeah.
advancements that they're making. And so I love that too, that this bulletin is written in a way that as there are advances and changes, it can really keep up with that for people.
Absolutely. And thank you so much for highlighting that, Meg, because it even lists, I mean, even if we just look a couple of years ago, that what we know, type of, or aptitude,
Mm-hmm.
and Discovery weren't on there. They weren't included. And so obviously the United States Preventative Services Task Force, USPSTF, they added their recommendation, added that on there. And so as we know, as drugs, as other modalities come available, we want to be very nimble, and flexible to the needs of our communities. And so one of the things in this bulletin that it mentions, it says if the FDA approves new drug therapies for PrEP or PEP in the future, those drugs will be subject to the coverage requirements of state law, even if they are not included in the general preventative services mandates under federal law. So I want to say that again.
Mm-hmm.
Even if
Mm-hmm.
it's not included in federal law, if the FDA approves it, it is going to automatically be covered by state law. That is huge.
Huge. Huge.
And so that is just, again, when we got this bulletin, like I could not believe it when I started pouring through it. And I was like, wait a minute, we didn't even ask for all of this.
Mm-hmm.
But that is, again, kudos to the Department of Insurance, Director Gillespie and KC Strauka, the chief of staff, and the people that work there, were putting together this very comprehensive uh, guidance on PrEP and PEP. One of the things I do want to mention too is that PEP is not considered under federal government, with the USPSTF,
Mm-hmm.
but it is covered on the state part. So that is, again, something, because we passed a law in 2023, that PEP coverage is now covered. Again, notwithstanding whatever is going on in DC, which is crazy this week. Uh, Notwithstanding whatever is going on with that, we're still going to be able to have this coverage that is going to be able to protect people.
Mm-hmm. And Tim, when you were talking a few minutes ago, we were talking about, this has a huge impact for the entire state. And also, there are certain communities who will obviously benefit from this bulletin being issued. And one of the things that you mentioned was, ensuring that this information is reaching patients. So, what role do you think that healthcare providers, whether that, as you said, is the pharmacist, the NP, whether that's a peer navigator or a social worker, what role do healthcare providers play in ensuring that these benefits actually are reaching their patients or their clients?
Make sure that this is posted. I know you mentioned, Meg, our fact sheet that we're going to be sharing out. Please put that out. We will be working internally with our comms team on creating some graphics that could potentially you could use in your social media. Uh, we really want to get the word out about this from every level of, whether it is a potential client, someone who is interested in PrEP or PEP, whether that is a provider, whether that is case management, whether that is a frontline worker. It doesn't matter. Everyone should know about this and understand that PEP and PrEP are great tools to prevent HIV. But again, what good does it do to have all of these great tools and no one is able, either one, no one knows about them, or two, no one is able to access them. And so, one of the things that I would love for you all to do, again, share this information, reach out to us. This is another thing that I would love for you all to do. And I'll be more than glad to put my information in the chat later. If you all are seeing anything or hearing anything where people are being charged for PrEP, that people are still running, or PEP or PrEP, that they're running into issues, whether that's insurance, whether that is cost sharing, whether that is prior authorization, any of the other issues, uh, please reach out to us. Because again, even though they put out this great bulletin, the work is still going to continue because there are some things that we still need to make sure that we get cleared up.
And Tim, I just dropped our advocacy at aidschicago.org. So if any of those things, if people are having to pay, if they are running into issues filling those prescriptions, or being asked for, the step therapy or prior authorization, please, please, please reach out. This is our daily monitored inbox for our team. And we'll make sure that it kind of gets to the right person. But this is stuff that we want to know. We want to make sure that with this change, there might be a pharmacy or a provider who isn't aware, and we
Yep.
want to be able to make sure people are complying with this change. So, Tim, you talked about you've been at AFC for about 5 years, and you said you've worked on this for 5 years. Tell me a little bit more, share more with me what advocacy efforts led to this bulletin. It wasn't just something that happened overnight. And weave in for me as you're answering this, why, I think a lot of times people think about policy work as happening in Springfield, our state capital, or happening in Washington, D.C. But why is this kind of work, this advocacy work, really critical for HIV prevention?
Yeah, it's one one of the things that it's a great question. One of the things that I love a lot of times in the HIV community, you'll hear a lot of times cross sector work or cross
Mhm.
sector collaboration, and that's essentially what this has been. I've been working on this issue since I've been at AFC almost 5 years now, and part of it has been part working with the federal government, so CMS, Medicaid and Medicare services released guidance in July of 2021 that basically clarified that PrEP and the ancillary services, so lab tests and doctor's visits, are to be covered without cost sharing. And that matters because we had tried to get guidance from the State Department of Insurance before that guidance was issued. We tried to get the state to issue guidance saying that, and they were like, well, we're not going to do it until the federal government says that.
Mhm.
Well, okay. Well, let's put a pin in that. Let's go back to the federal government along with our national partners to ramp that effort up, to get that out. And so that came out. They released a guidance in July of 2021. The State Department of Insurance did. But it's not as comprehensive as this one. I'll say it that way. And so we were still running into issues. Case in point, we found out from our national partners at the AIDS Institute that we still had some Illinois insurers that are charging for PrEP. And so we used that information to write a letter to the Department of Insurance last summer to say, hey, this is the law. You're not supposed to be doing this. Can you send something to insurers? Can you issue another more comprehensive bulletin to make sure that all the T's are crossed and the I's are dotted? And so it's literally working between administrative advocacy. It's been working on state law. I mentioned earlier we passed a bill in 2023 that basically encoded protection of PrEP and PEP in state law. Working with federal partners, whether that's at CMS or with the AIDS Institute. That means talking a lot to providers, case managers, talking to just everyday people who are vulnerable to HIV. And so it's literally been a cross sector of trying to, one, be responsive to community, and making sure you're keeping them in the loop every step of the way, and understanding that, hey, this is where we are right now, but this is where we're trying to get to. And so that's where we are right now.
And Tim, do you think I think there's a lot of questions that people have in the Q&A, which I know you probably can't see on your end. And we're going to try to address these as we are able to. Anything we don't address today, we will follow up. We know this is a really complex
Yeah. Yep.
conversation, so we'll follow up with email to people because I'm seeing some folks asking about, specific interactions for specific medications or with different types
Yep.
of plans, with things that are happening at other levels of government with the Supreme Court. So
Yep.
we see your questions and we will answer them as best we are able to. The next question I have for you, Tim, is really about, you just outlined kind of the advocacy efforts that went into getting this bulletin published. What kind of lessons can we take from that process? And really, whether that is using them for other advocacy initiatives or at the federal level, like what lessons learned here when we think about HIV prevention and all that went into this, can people then carry forward to help support getting to zero in the other advocacy asks and that channel, whether that's legislative or administrative advocacy, like you've been talking about? What can we learn? Take the best, leave the rest here.
Yeah. One of the things I will tell you is all hands on deck. Every one of us on this call has a part to play in policy, and you may not even realize it. Yes, I am a policy person. This is what I do. I enjoy it immensely. However, I am not a doctor. I am not someone that knows all of the background and the ins and outs of all of that. So I have to rely on providers and nurse practitioners, pharmacists, to provide me the information that I need in order to put in good policy. And so that's how we get to where we are today. And so when I say all hands on deck, that's what I mean. So when I talk to case managers and they're telling me what they're seeing, or when I talk to cabs and they're telling me, well, Tim, I want to get on it, but they won't, I ran into this issue. Well, that's extremely helpful. You all may not think that it is, but being community centered, um, that's what we use at the heart of our policy making. And the things that we work on is how do we center community in everything that we do. And so that's one of the biggest takeaways. Another one is slow and steady wins the race, y'all. As I mentioned, it's 5 years. And it's actually longer than that because the youth PrEP bill that AFC worked on predates me before I even got here. And so again, slow and steady wins the race. Um, if I'm not mistaken, my colleague Kim Hunt is on this webinar working on a bill with her for equitable restrooms. Bill took 8 years to get passed. 8 years, y'all. And so slow and steady wins the race. You just have to keep at it. And when people tell you no, don't necessarily hear no, just hear not yet.
Mm-hmm. Mm-hmm. I love that, Tim. It's such a call to like stay plugged in, stay engaged.
Yes.
I think especially, we've been having a lot of conversations about how do you do that in these coming months and years here. And one of the questions that is coming up in the Q&A is about when this is implemented. Is this something that takes effect immediately, Tim?
Yes.
Okay.
As of any health plan that began January 1 of 2024.
And
So,
so
yes.
again, if people are running into issues where they are still being asked to pay for their PrEP, now that this has been implemented, they can reach out to us, reach out to their insurance providers, reach out to their healthcare providers, so that they aren't running into issues like utilization management and cost sharing.
Absolutely. And make sure you also circle back with us, because there are avenues with the Department of Insurance for you to file complaints. And we want to be able to use all of the avenues that we have at our disposal, because again, this is federal guidance, it is state guidance, and it is state law. And so we want to be very, very clear about There should not be a single cost for PrEP in the state of Illinois.
And Tim, let's turn for a minute and bring it back to this is a getting to zero Illinois conversation. So let's really
Mm,
connect the dots for folks. You know, my goal as the director of special projects who is leading our getting to zero work is always to look at like what is happening around us. How do we tie it back? How does it relate to getting to zero? How do we tie this back to getting to zero? How does it impact our work with getting to
yeah.
zero? So you know, we for folks who maybe aren't as familiar with getting to zero, the aim is to achieve functional zero HIV transmission, so 100 or fewer new HIV transmissions in a year by 2030, and really doing that through an equitable systems level kind of strategy that focuses on prevention, diagnosis, and treatment, all while improving the quality of life for people who are living with and vulnerable to HIV. It's doing a lot of things. You know, that's a big ask and a big lift. But tell me, how do you feel like, Tim, that this change really directly ties into that mission of improving people's lives who are living with and vulnerable to HIV and making sure that our prevention, diagnosis, and treatment efforts are in line and we're working towards our goal of getting to zero?
Yeah, because we understand that the prevention of HIV is obviously very critical to our efforts to end the HIV epidemic here in Illinois. And so, what does that look like? Obviously, that deals with access to PrEP, to PEP, to other modalities. It also includes education. It includes making sure that people who are living with HIV are undetectable. Obviously, treatment is prevention. U equals U. It is all of those things put together, and when we put those things together, we will begin to really reach some of these milestones that we want to as we work to end the HIV epidemic. But the issue that is always stood out to me, and it's the things that I share most with legislators, is none of this is going to be possible if we do not take care of barriers to care, and whether that is making sure people have health insurance, that people have access to prevention tools like PrEP and PEP, throw in DoxyPEP, and throw in all the things,
Mm-hmm. Mm-hmm.
that they don't have education. And so making sure that we're working on sexual health education and all of the things, that we are looking at how do we go about getting to zero and making sure that we make our community whole. So looking at the full gamut of things, housing, transportation, all of the like. And so this is just, again, this is very, very important, but it is just a piece of it. But it's a large piece of how do we get to zero? How do
Mm-hmm.
we continue to move the work forward? And all of you all that are on this call, this webinar, whatever the technology is today, uh, y'all play a tremendous part, because in whatever corner of the state that you're in, you have an outsized influence on, again, listening to community and hearing from them about what they need. Because again, if you are in Rockford, the needs of people in Rockford are going to differ, obviously, than the people down in Champaign County.
Mm-hmm.
And so we have to be responsive to that. And that's how, when we start thinking about it that way, that's how we will move closer to getting zero.
I love that, Tim. And I think it's such a holistic approach. You know, we have guiding principles that really
Yes.
undergird the entire plan as it's written. And I think you're really hitting on one, and I want to elevate a piece of this that this bulletin helps to remove the administrative and the financial barriers that people face
Yes.
when trying to access prevention. What this bulletin cannot do is
Mhm.
remove the stigma that comes along with accessing prevention, knowing your status and accessing prevention medication. And so I think that too is a huge call that like we that is some of the next work of how do we continue to acknowledge and address that HIV stigma plays a huge role in somebody seeking to know their HIV status and then plugging into the appropriate level of care, whether that is prevention or treatment. So how do we kind of dismantle the stigma around HIV while also normalizing prevention? Like there's a lot of work there ahead of us. And so I think You
Oh,
started to touch on it. I know that's a whole, I mean, that's a whole different community conversation for another day.
yeah,
Um, but you started to touch on it. What is next? I'm going to drop the one pager that we have into the chat for people. But looking ahead, what else needs to happen? This is a great step, and it's a huge step, but it's just one step. So at the policy or the community level, what needs to happen next in your mind? What is the short-term and long-term vision to kind of maximize the impact of this change?
sure. Short term. Well, let me touch on the S word. Anyone that knows me has heard me speak. I say this all the time. Part of my job is also to make sure we get additional funding on the state level, federal level too. Uh, but and I've often said this: we can literally have all the millions of dollars in the world, but if we do not address HIV stigma in a meaningful way, we will never be able to end the HIV epidemic, because it is a thing and it's not going anywhere. So, how do we address HIV stigma? We do that through policy. Well, specifically, we do it through policy. And so, one of those is in the short term is implementation of a bill that we passed in 2022, that Meg is now leading our work on, that I had been since the passage of the bill, which is pharmacist initiated PrEP and PEP. And we are well on our way of implementing that. This is another one of those instances where slow and steady is going to win the race, y'all. This bill went into effect January 1 of 2023, if I'm not mistaken.
Mm-hmm.
And it's still not properly implemented because there are a lot of things standing in the way, and things that we just need to get done. And so that's one of those things in the short term. Another one of the things that I want to mention, we worked on a bill in 2024 called HIV TLC, that was trying to make it to where HIV STI at home testing kits are covered without cost sharing.
Mm-hmm.
Unfortunately, we ran into a problem with that. And the problem we ran into that is HFS, which is the state's Medicaid agency, came back with a total that said that if we did that, it would cost, what was the total? Is it $35 million? If I'm not mistaken, off the top of my head. Um, and so, and it would cost the state a lot of money in order to be able to do that. And so, uh, that's something that we're having to, again, I don't hear no, I just hear not yet.
Mm-hmm.
And just kind of rework. There are other things that are out there we're working on in 2025. Basically, get rid of utilization management completely for HIV treatment. And so, and because obviously we already have it for HIV prevention. And so those are some of the things, again, short term, medium term, long term, how we can go about just, again, affecting more change to get us there, to where we want to be.
Tim, it has been so much information and so informative. You've really like helped me to better understand. I've sat with the bulletin, I've read through it, but I feel like each time we talk about it, I understand it a little bit deeper. And so I would encourage folks today, if this is the first time you're hearing about it, let it sink in. Please reach out to the policy and advocacy team at AIDS Foundation if there are questions. You can reach out to Tim as well. But before we move into other questions, because there have been a lot that have come up as we've been talking to him. The final question I have as we move through this series of community conversations, I really want to close out each of them by asking my guests, which you've been the great first guest of this. You've set the bar high for other folks. If someone is learning about getting to zero for the first time today, or if someone isn't quite sure how they fit into our efforts, what is the one thing that you want that person to hear? And what is that message to them?
One of the things I will share, and it's somewhat personal, but again, this is if anyone has ever heard um, my story. I am a person living with HIV, and so one of the things I tell people is that my work is built off a promise I made to my late aunt, who died from AIDS-related complications in 2006. And so I made that promise then, and every day that I get to do this work, I get to keep that promise. So to a person that just heard for the first time about what getting to zero is and how they can play a part is, what promise would you like to leave? What promise would you like to make to be able to affect positive change in your community? Again, you don't have to be a policy person, but if you are in a sorority and you think it would be good for your sorority or fraternity or other social group to do a program related to HIV, HIV education, and want to connect with GTZ, that's a great way to do it. If you are in your church or mosque or what have you, and you want to start an HIV, um, uh, not a caucus, I'm thinking political right now. But basically, it's a group in your church to do education around HIV. Reach out to us. We'd love to be able to partner with you on that. If you don't know where to start, reach out to us, and we would be grateful to give you a head start on that. Again, everyone has a part to play in ending the HIV epidemic here in Illinois. And we would love to be able to partner with you in figuring out what that is. Oh, another one of the great things I tell people all the time: if you're an artist, if you're someone that is uh, artistic and things like that, we can use that too. If you're a photographer, everyone can be used. And again, that will just be your promise to end the HIV epidemic here in Illinois.
Tim, I love that because it's like I am not an artist. I am not. My best doodle is maybe a square on my like meeting agenda. I
Yeah,
wish. And as I talk to people about like how can they be engaged in advocacy efforts, really what it comes down to for me, it's about education. Like,
yes,
pull back all of these ideas about advocacy and lobbying, and really at the end of the day, we're trying to have conversations with people. We're trying to share information so people can feel empowered. And there's no, I like what you were saying. There's no wrong way to start that
no,
process.
no,
Wherever
no,
you are, start there today, make that commitment. And I think, like you said, it's going to take every single person to help us kind of reach our getting to zero goals.
absolutely.
So, with that, my friend, I have a couple questions from folks if you are
Sure,
feeling up for answering them.
absolutely.
Do these policies, does this bulletin apply to all types of insurance? So, Medicaid, private insurance, Medicare programs?
I'm going to read directly from the bulletin, that all individual and group policies of accident and health insurance, HMO healthcare plans, and voluntary health services plans that are amended, delivered, issued, or renewed in Illinois on or after January 1st, 2024. So the question to that covers Medicaid, that covers ACA plans. That there's actually some guidance in this bulletin that if you have hold it just a second, I want to make sure that I'm reading it correctly. That there is some coverage for high deductible health plans. So there's coverage there too. So yes, if you have a plan that is regulated in the state of Illinois, it should be covered. If you won't, you can just reach out to us directly and we can check and make sure.
Okay. And then I know that this is a little bit of melding of world, but somebody asked, will this also be accessible to folks who are undocumented and can't get health insurance coverage? How does this play out for people who maybe don't have access to health insurance coverage?
That is a great question. One of the things, and I think I saw Michelle Ferguson on here earlier. I am not sure what the extent of, off the top of my head, on how PrEP for Illinois can help with that. PrEP for Illinois is the state's program to help with PrEP coverage. Um, that's a great question. Okay, tell you what, reach out to me. And that's something that we can. Yeah, thank you, Andrea Perez. Thank you, Andrea.
And
Is the
will you take a second for folks who don't know what PrEP for Illinois is? Can you break it down high level? What is PrEP for Illinois and how can folks access that? And I will try, or Andrea or Michelle, since I think you're both on. If you want to drop the link for folks so that people can go ahead and have the link for PrEP for Illinois' website, that would be great.
Yeah, PrEP for Illinois is just a great program for people who are interested in getting PrEP coverage. Michelle and the staff at IDPH do a great job of trying to link people who can to see if you're eligible for the program. And so I think Michelle just put the link in the chat. And that's something, again, another resource that we can share out to people to see if you're eligible for that coverage. And we have been working with state legislators to make sure that there remains money in that pot to make sure that coverage continues. And so it's just, again, another resource for people to be able to count on.
Wonderful, Tim. And I'm seeing both in the Q&A and in the webinar chat that our folks from the state are saying PrEP for Illinois can absolutely assist if folks are undocumented.
Yes.
So for folks who are uninsured as well as underinsured.
Underinsured, yes.
Absolutely. Okay. So I'm going to go ahead. Thank you, Tim, for any last kind of words as I pull up. I'm going to reshare my screen for people so that we can move to just a couple more things that we want people to walk away from this conversation with.
I just want a couple of things, Meg, while you're doing that. There's a couple of things I do want to highlight. Again, thank you to Michelle, to Andrea, to Nadine, my colleague here at AFC, for putting that information to clarify some of those questions for me. Thank you. One of the things that I don't know if I was able to hit on too was this bulletin, also a couple of things, provide some additional information related to billing and coding for PrEP services. So if that's some questions that you have, this is a great place for you to kind of start to get some of those questions. Also, it also makes reference to Illinois' ban on copay accumulators. And so all of that, and so there is information in this document that includes information about that as well. So again, please feel free to reach out to us, advocacy at aidschicago.org, if you have any questions or you want to share any anything that you're seeing on the ground related to this issue or anything involving HIV prevention or treatment.
Thank you so much, Tim. I feel like I want to keep talking for the next like 2 hours here. And I know that Tim will be back for another community conversation. So on that, I've started to reshare my screen again, folks. I want to invite everybody who's on today's call to attend our next month's community conversation. So join us in February on the 19th, Getting to Zero community conversation. It's leadership and legacy in HIV advocacy. So we're celebrating Black History Month and the power of Black advocates in HIV advocacy. In this conversation, we're going to hear about how strength in the Black community drives really meaningful change in the fight to end the HIV epidemic. We're going to talk about foundations that have been laid, people, advocates, activists who have paved the way, as well as really, beautiful people in the next generation coming up who are carrying this work forward. So feel free, I'm going to drop in the chat the registration link. You can also use that QR code. The registration link is on the screen as well. If you have enjoyed today's conversation, which I hope you have, many of you have stayed on with us for almost the whole hour here, please stay connected to Getting to Zero and to AFC. On screen there, and all of this will be in the follow-up email, so don't feel like you have to scurry to scan anything or click on the links here. But you are going to see things for our GTZ partner sign-on. Our partners are what make the work move forward. AFC is simply one steward, one partner in moving this work forward, along with our health department partners and our partners throughout the state. So as Tim shared, as I reaffirmed, we need everybody to be plugged in order to reach our Getting to Zero goals. So if you'd like to be a partner, go ahead, click that link, scan that QR code. Tim mentioned the number of other kind of policy and advocacy opportunities that are available for folks. As those become available, we want you to join AFC's Mobile Action Network. You can do that by texting 40649. Oh no, you have to text AFC to 40649. Again, texting AFC to 40649. There's also a way to do it via your phone or computer if you don't want to text. But we would love for people to plug into the Mobile Action Network as advocacy and policy opportunities become available. AFC mobilizes our network of advocates to take action, whether that's on the local and municipal level, all the way up through our federal policy work that we're doing. So if you're policy minded, if this conversation really, struck something in you to say, I could do that. That's my commitment. That's my commitment today to taking action. please feel free to plug into our mobile action network. And then finally, we would love for folks to jump onto the GTZ mailing list. So this QR code, this link is going to go ahead and take you over to our mailing list where you can identify what you'd like to hear from GTZ and from AFC. This also includes our monthly newsletter, which we restarted in January of this year. So Beyond Zero, it comes out once a month. We really highlight the work that's being done on the project, the work that's being done across the state with our partners. Last thing I'm going to go ahead and have you guys do, I really want to thank Tim first and foremost for your wealth of knowledge, answering people's questions, really breaking it down. It's complex stuff and you made it much more accessible. I also want to take a moment to thank our partners at the state, specifically our Illinois Department of Insurance partners, especially Director Gillespie. Please feel free in your networks, on your social media. This is a huge step forward, not the last step forward. But we want to thank the folks that made this work happen and who have worked tirelessly to really make this bulletin happen. And then I want to take the opportunity from me to you, cold, snowy Forest Park, where I'm at, to wherever you guys are. I really appreciate you joining us for your lunch hour. Please look out for the email with all the links in the slides. And if you enjoyed today's conversation, or you want to share with us how we could make things better, I'm going to drop my last link that I have for you all. I'm putting a lot in the chat here. I'm going to drop this last link in the chat for you. This is our post-event survey. So jump in there, tell us, I really enjoyed this piece. I didn't love this part so much. Or if you have an idea for a community conversation, we're going to be holding these throughout the year. If you say, I have expertise in this and I'd love to join you, Meg, for the lunch hour to chat about something, I would love to welcome you as a guest to this conversation. So with that, thank you for your time. Stay warm, stay safe, have a lovely afternoon and a lovely weekend. And thank you for being part of the Getting to Zero community. Bye, everyone.